coronary, structural, and adult congenital heart disease interventional cardiologist, Dr. Tahira Redwood is here, and she's going to tell us about the pioneering area of treatment in heart surgeries that is being done at the UHWI, and it's significantly reducing surgery and recovery time. And if you've ever been a heart patient, that is so important. Morning, Doc. How are you?
Good morning, and thank you for having me here today.
One of the first things I want to underscore, and I said it before, is we have some of the best people in Jamaica that have been dealing with heart issues and heart surgery. I don't know if it's the recruitment. I don't know if it's the... What do you think makes it so?
I think it's the training, and we have a very good connection with one of the biggest hospitals on the western side for cardiology, which is the University of Toronto, Toronto General Hospital. And a lot of the cardiologists in Jamaica actually have been trained there. So they get expert treatment. It has the largest heart transplant center on the western North America. It has the largest congenital adult program in the world. So they, Jamaicans training there get excellent training.
I have to say, I had to say, because a lot of times we talk about, things that aren't going right with Jamaica. Trust me, that's one of the things that's going very right. And I've had to deal with heart issues across America and Canada, and kudos to you. So this is cutting edge that's happening here at the UHWI. Tell me a little bit about it.
Well, I train in Canada, as I mentioned, and we do a special minimally invasive heart procedures, heart surgeries, where we can replace valves, we can close holes in the heart. Typically, people are used to doing heart attacks, minimally invasive meaning they go through a blood vessel in the leg or the arm instead of opening the chest wall, and they can fix the vessels. So we've been doing that in Jamaica for a number of years, maybe 20 years, but we've never had heart valve surgery being done. Usually you have to open the chest, cut through the breastbone, and have what we call open heart surgery, which can be very long and have a very long recovery time. It requires intensive care unit beds, which we know are very small in number in Jamaica. So bringing this to Jamaica was, very needed, and to the Caribbean, to be honest. So we're doing this now at the University Hospital of the West Indies. They have something called an interventional suite. It's a state-of-the-art machine. They acquired it, I think, within the last 5 years, which has been able to give me that capability to do these procedures in Jamaica.
Wow. Because a lot of times you hear people say, I have to go overseas. You don't have to go nowhere. Right here is good. And what I like about it is because it's minimally invasive, as you said, the recovery time is maybe not just shorter, but the percentage of success is higher, I believe.
Yes, so many of my procedures that I do, especially the heart valve replacement, so I put a new heart valve if your heart valve is very narrowed, or I can open up the heart valve if it is narrow. And many of those procedures usually are higher risk because it's usually older persons that will have this. Yes. They have diabetes, they have kidney problems. We have a lot of hypertension in Jamaica, so they're at higher risk for surgery. So it was typically made for patients with these high risks. And because it was made for those patients, it's very safe. So our mortality here for my procedures right now is 0%.
Wow.
Worldwide, it's very low, less than 1%.
I'm telling you.
So it's really made for high-risk patients, but it's so successful, it's been made for all patients. Low risk, moderate risk, high risk, it's that safe.
Yeah. So it's been here for a while. Like, what's been the feedback from the patients themselves? I mean, from your end, I know the rate of success would depend on, as you said, the length it takes to do the surgery, the success of what it is you have to do. But what has your patient feedback been like?
Well, the eldest patient I have done is a 94-year-old, and she was really a great 94-year-old, walking around, mine probably better than all of us. And she was just really, really sick and was not getting any better. And when I did her valve, you don't know which way it's going to go. She's 94. And I actually just got a message maybe a couple of weeks ago saying that this is a year later. She's 95 now. Wow. And it's the best thing she's ever done because she can visit her friends. She can go out on the road. She was a roadie. So she can go out on the road. She can do everything she used to do. So I get really good feedback from the patients. Of course, they never had to go to the ICU. They were up and about the same day. They were discharged from hospital within days of the procedure. So we get pretty good feedback from the patients.
Quality of life. And I think it's important when you say that, because a lot of people, one of the challenges challenges I have is that once seniors get to a particular age, people say, oh, well, you know, they're old and they're going to be sick and they think it's par for the course. And so they don't seek treatment and they don't try to address whatever issues they have, including heart issues. But I'm hearing now that, listen, guys, it doesn't matter the age, come in. Let's have a look.
Because you have 60-year-olds calling themselves seniors. I'm like, you're 60. You're so young. They're like, oh, I've reached, you know, I don't need anything. And I'm like, no, you have so much life ahead of you. And we can make you feel so much better. Yeah.
You're the only person in the Caribbean that's qualified to do this thing?
So I am the only person that's trained to do both what we call structural and adult congenital, because my program was very unique that gave me both of those training skills.
Wow.
I'm probably the only Jamaican as well. I've tried to find others, but no success yet in the world. But yes, I'm the only one in the Caribbean that does adult congenital intervention and structural.
How does it make you feel?
Good. I mean, I wish I had someone, else to
have some kind of conversation.
Yes. If I have the conversation, I have to call, my colleagues in Canada.
Right.
But it makes me feel good that we can bring this to the Caribbean and especially Jamaica, because it was much needed for various reasons. And, I just wanted to expand it, especially into the public system, because it is an expensive procedure. I'm not going to say it's super affordable. It is, because the things that we use are expensive, but it's much more affordable than if you were to go to the US. So it would be at less than 30% the cost if you were to go to the US, for sure.
Did you always want to become a surgeon?
I always wanted to use my hands, like a hands kind of person. I've wanted to be a doctor since high school. And then one day I saw, I always wanted to be a surgeon, but I went into cardiology first, general cardiology. Then I did this minimally invasive. So I'm a minimally invasive cardiologist. So it's minimally invasive surgical procedures, but I didn't go the surgery route.
I think one of the things, even for doctors who are GPs or doctors who have their patients, are now saying, well, at least there's an option for us, because, nobody gets to you without a referral.
Yeah. Well, there are some patients that will find me. They'll be like, oh, I saw you on, or I have this procedure, and they say I have to do open heart surgery. Can you fix this? And I'll be like, yeah, we can fix it. You know what I mean? So it's really good that it's getting out there. I really would like the family doctors to know it's out there, because there's a lot of patients and a lot of doctors that don't know this is feasible and available in Jamaica to them.
No, I have friends who've done heart surgery here in Jamaica, and I tell you, they're faring out better than others that I know that have done it elsewhere. And that's why I continue to say I think we have some of the best. Is this only being done at the University Hospital of the West Indies? It
is. The type of machine that the University of the Hospital of the West Indies have allows me to do a lot of other procedures.
Okay.
It's a little bit more complex than a regular procedure. So my procedures specifically are only done at the University Hospital of the West Indies. Of course, for the heart attacks, there are other institutions that have this. Andrews Memorial just opened an institution. I know Hospital will be opening one specifically for heart attacks and other illnesses.
Doc, I love you, but I hope that there will be a day when the society will be so fit that we'll say, Doc studied so hard and there's no surgery to do. But until then, congratulations to you.
Thank you so much.
And thank you so much for all that you do. So listen, there is hope, guys. I tell you, with technology, some of the things we used to worry about, we don't need to worry about them again. There's somebody who did the work for us. Thank you very much. Coronary, structural, and adult congenital heart disease interventional cardiologist, Dr. Tahira Redwood. After the break, we look at the impact of case management for behavior improvement. We'll soon come.